Nobel Prize-winning author George Bernard Shaw famously was quoted as saying, "The reasonable man adapts the world to himself, while the unreasonable one persists in trying to adapt the world to himself." So here I stand in front of you as an unreasonable man. And I know that in a room full of innovators like I see here, I'm in good company. So in the next 6 minutes or so, I'd like to take this opportunity to show you the future that we at Omega Ophthalmics are trying to create. This future is full of new opportunities to help patients in real and tangible ways. But to do that, I'd like everyone to momentarily try to forget what you know about cataract surgery and the function of IOLs. Instead, let's think about the eye as a real estate venture. We all know that good real estate ventures always are about location. And in the eye, there's an often overlooked piece of prime real estate that is in the perfect location that could potentially hold the key to the future of ophthalmology. The space I'm referring to is inside the capsular bag, which is the only non-reactive space in the eye, and perhaps the entire neurological system, that can indefinitely hold biologically inert implants of all types. For that reason, the capsular bag may just contain the most precious real estate on the planet. You know, for too long, we've thought about the capsular bag as simply this space to hold a thin, foldable lens. Well, I would say that even after decades of trying to optimize our results, we still haven't achieved LASIK-like outcomes. So why is that? Well, when we allow the lens capsule to shrink wrap itself around the IOL, we're allowing the guesswork of effective lens position to hamstring the precision and accuracy of our results. Not to mention, when we do this, we lose this prime real estate for future endeavors. So, why is that? Well, until now, we've really had no other choices. However, I would say that's a consequence of thinking and dreaming too small. At Omega Ophthalmics, we believe the opportunities for advancing human vision, for pharmaceutical delivery, biometric sensors, and even advancing the field of augmented reality all depend upon keeping the capsular bag in its open conformation and retaining the ability to access it for future implementation. So how do we do this? Let me show you our vision.
What if a single device could change the way we treat the most common ophthalmic conditions, including cataracts, glaucoma, and macular degeneration, and at the same time provide a platform for the integration of augmented reality? Introducing the Omega Gemini Refractive Capsule, the platform that forever links ophthalmology to high technology. This device is a three-dimensional implant that keeps the capsular bag open, contains a true refractive lens, and maintains an open space for drug delivery, biometric sensors, and additional lens technologies. Our device has been engineered to work with intraoperative aberrometry to ensure that the correct visual outcome is achieved. It is designed to hold additional lenses that can be implanted during the primary surgery for refractive fine-tuning or in the future to upgrade the patient's vision. Gone are the worries of choosing the correct lens power or exchanging technology that a patient may not tolerate. By maintaining an open space in the capsular bag, we have created the optimal platform to house intraocular technology. This protected environment is the perfect place to seamlessly integrate virtual and augmented reality devices currently in development, providing a new frontier for this exciting technology. The future of innovation is a journey into open space. The Omega Gemini Refractive Capsule is the next platform to take us there.
So as you can see, the Gemini Refractive Capsule preserves the open intraocular real estate. It also provides flexibility for future enhancements. It's made out of traditional materials and goes through a traditional insertion process. Recently, we completed our first-in-man trial, and we showed that our lens was equally safe and effective to a traditional hydrophobic acrylic lens. And so now I'd like to debut, for the first time anywhere, video footage of our first human implantation. So this is going through a standard 2.75 millimeter incision, and this is just a standard off-the-shelf injector. And what you'll notice is as the lens unfolds, it comes out in a very slow but controlled manner. There's nothing surprising about this. When it goes in, it keeps that precious real estate of the lens capsule open. This lens particularly contains a 22 diopter monofocal optic, and once it's in the eye, it just looks like a regular lens. But we've got this precious real estate for future implementation if we want. At this stage, we are well funded through private capital investments and are not seeking additional investors at this time. We have made a few improvements to our prototype, and we hope to test those in the coming months with a near-term goal of performing a large-scale OUS trial. I'll leave you with one final parting thought, and that's another quote from George Bernard Shaw. He said that some men see things as they are and ask why, and others dream of things that never were and ask why not. So be the dreamer, be unreasonable, ask why not, and let's push ophthalmology forward together. Thank you so much.